Despite the fact that the Shambyu Health Centre is plagued with a myriad of issues, regional leadership is convinced that most of the problems hampering quality service delivery are not unique to this health centre only. From the information that was shared, it seems like the health centre here is dealing with every problem under the sun. Staff members say there is a serious shortage of medication, with them often having to wait up to 3 months for their orders, and when the medication eventually arrives, they only receive 40% of what they ordered. The centre does not have gloves, and they have resorted to hiding the few gloves they have for extreme emergencies. The staff also admitted that they sometimes have to use unsafe methods, particularly during delivery due to the lack of gloves. The Shambyu Health Centre has run out of malaria testing kits. The lack of appropriate infrastructure means that there's no privacy between various patients. They don't have an isolation room, and the nurses buy their own uniforms. The health centre does not have a pharmacist or a medical officer, despite the centre operating for 24 hours. Staff also admitted that pre- and postnatal services are poor. There are no transport services, and if the centre does call for an ambulance, the fleet is so old that sometimes medical vehicles break down while transporting patients. Those who work here say they are understaffed and overworked, and this is preventing them from providing quality health services to the community. Acting Health Director in Kavango East, Waitaka Pumburu, told the parliamentarians that a number of issues have to be sorted out, including reviewing some of government's procurement procedures. He also said government needs to review its agreement between the Catholic Health Services in terms of infrastructure so it becomes more responsive to the needs of the community. Even though the Shambyu Health Centre falls under Catholic Health Services, it is 100% subsidized by government.